Hi, my name is Christian Henderson, and this is my presentation of my interview with Lori Conlin. So, who is she? Lori Conlin is a nephrology nurse, which is basically a nurse who deals with kidneys, at New York Kidney, which is a branch of New York Health. She's been working in the healthcare industry for over 25 years, 8 of which she's been using an electronic health record system. Currently, she's also working at St. Catherine's Siena Hospital, and the interview was conducted over the phone since it really wasn't feasible for me to catch a flight to New York during a global pandemic. Um, so I started the interview by asking her about the different EHR systems that she's used. In the 8 years she's used EHR systems, she's only ever used three different systems. The first she used was eClinical, the second, Flatiron Health, and the third was Epic. When I asked Miss Conlin which of the three was her favorite, she let me know right away that it was not eClinical. She told me that when it was initially implemented, quite a few doctors who were close to retirement ended up quitting because of it. So I asked her the reason for her strong distaste for it, to which she replied that the likely reason was because it was the first that she had to learn. And at the time, it was very overwhelming, and it seemed like there was a lot of boxes she had to open to find information. According to Ms. Conlin, the reason eClinical was initially implemented was because there was a financial incentive for meeting certain patient goals. From the little research I did into the subject after the interview, I did find documents mentioning financial incentives from implementing EHR dating back to 2009, though they didn't explicitly mention eClinical, so my assumption is that it was for implementing any EHR system. Miss Conlin's favorite EHR system was Epic. Epic was the third one that she had to learn, and she said it was the easiest to understand for her. When I asked her why that was, she wasn't sure if it was just because she's gotten used to it or if it was actually easier than the others. Unfortunately, she didn't have much to say regarding Flatiron Health. She liked it better than eClinical, but not as much as Epic. So the second question I asked Ms. Conlin was about the benefits of EHR systems. She decided to start with telling me a short story from the day. Supposedly, a man came in that day who wasn't 100% all there, and there was no family that they could get in contact with. But through the magic of electronic health records, they were able to look up his records from a few months ago when he was admitted and could access lab reports and imaging going back years. During the pandemic, EHRs have been especially useful. What used to be a whole process of requesting information from one hospital can now be done in little to no time, saving tons of time for doctors and nurses. And since so many people are visiting the hospitals for various COVID and non COVID related reasons, it's even saving even more time. Another benefit of the EHR is that it allows her to check information from home via a laptop secure link, meaning that she has the ability to work from home if she's allowed to by her employer. So the third thing I asked Ms. Conlon was about how these systems have impacted her work, whether positive or negative. Her absolute biggest complaint that she mentioned numerous times throughout the interview was that a lot of times people will overload EHR records with non important information. So basically, the records that would be sent would have a ton of information that would not relate or be important enough to include, which would lead a lot of people to skim or even skip reading the information altogether. And if they did read the information, it would be wasting a lot of valuable time. Another important impact was that sometimes the system goes down, and when that happens, there's very little that they can do since the system's so integral to their work. While it doesn't happen often, it's still a major impact. Some other noticeable positive impacts are that she can write and send prescriptions through the program, and she can also keep track of what vaccines and prescriptions patients have taken. So the fourth question I asked Ms. Conlin about was how secure EHR systems are. Unfortunately, this question was a little above her expertise. She told me she wasn't aware of any real security threats. The only potential threat that she knew of was the users who are using the EHR system. Um, she told me you have to trust the user to be ethical, and to my knowledge, I think they're fairly ethical because patient information isn't too often leaked, to my knowledge at least. While she didn't know much about this subject, she did mention Stony Brook Hospital having a financial related security breach not too long ago. I did my own research into this subject and learned that this event happened in May of 2020. Blackbaud, a cloud computing provider, experienced a ransomware attack where customers' bank information, social security numbers, usernames, and passwords were compromised. While the attack occurred in May, the company failed to disclose it until July of that year. Luckily, Stony Brook wasn't actually keeping social security numbers and bank information in this system, only usernames and passwords. So it was a big deal, but it wasn't as bad as it could be. Um, the event ended with Blackbaud paying the ransom for proof that all the information was deleted. Um, so it has since been resolved. Uh, the last thing Miss Conlin mentioned to me about this subject that while she doesn't believe they're lax on security where she works, she still wouldn't go to someone she works with for health related issues. And this comment stuck out to me. I've thought about it quite a bit since the interview, and I wish I would have asked her to go into detail about it. And at first, I was perplexed why she would tell me they aren't lax on security, but she still wouldn't go to them for help. But after a while, I came to the conclusion that the most likely reason for this statement was not that she didn't trust the people she works with. It's more that she doesn't want her coworkers to know the private dealings of her life, which seems like a fairly decent thing to want to me. So the fifth question I asked Ms. Conlin about was about telemedicine and whether her organization has implemented it, and if so, what have been some benefits of it. So, since the start of the COVID 19 pandemic, New York Health has started offering telemedicine services so patients don't have to go in to visit the doctor. Patients can conduct the appointment via Zoom or FaceTime, and if they're technologically illiterate, they can even conduct the interview over the phone. It doesn't just benefit the patients, though, she said. The doctors are helped by this too. Rather than have to meet face to face with people throughout the day, they can meet people via scheduled digital appointments. And a lot of patients that telemedicine helps the most are the elderly. Before telemedicine, older people would have to drive to the doctor's office, which may not be the safest course of actions for them and others. And now they can stay home and prevent putting themselves at an unnecessary risk. When it comes down to the effectiveness of telemedicine, Ms. Conlin said that that telemedicine only is effective if you ask the right questions. Every patient is different and needs to be treated as such. So the sixth question I asked Ms. Conlin about was the greatest benefits of HIT. So, in her eyes, the greatest benefit of health high tech is the sharing of information, organization it provides, and continuity. And thanks to the contributions of HIT, they can send notes to a patient's doctor after a visit quickly and efficiently. Another benefit is that it's supposedly harder for people to go around to different doctors' offices and hospitals to get controlled substances, since there's now records of these things. And also, supposedly, doctors are less likely to give out repeated prescriptions for controlled substances. Um, while Ms. Conlin had plenty of nice things to say about HIT, she brought up her major complaint once more about how the more information that is included in the notes on these health HR EHR records, the more simply the more people will simply ignore in these documents. So the final thing I asked Miss Conlin was if there was anything else she would want to share to me about any of the subjects we talked about. Um, so she spoke about how now they have a dedicated IT team whose singular purpose is to make sure the systems are up and running and working on a day to day or running smoothly on a day to day basis. Uh, which means there's less likely that the system will be down or they'll have an outage. She also told me how prior to the implementation of the EHR system, she'd constantly receive complaints about her handwriting, and now that's a thing of the past, obviously. Uh, she told me that there's always a chance that EHR records may not be accurate. Due to user error, wrong information may be entered, or information from one person is put into the record of another. Um, if these problems aren't sorted out as soon as possible, they can cause massive issues for staff at a later date and time. Um, and before we before we ended the interview, she talked about some improvements she would like to see in the EHR systems. She said that she would like a singular EHR system for all hospitals and medical facilities because currently a hospital may use Epic, but then their outpatient dialysis may use a completely different EHR system. She then proceeded to tell me a rumor that she had heard about how supposedly Microsoft was attempting to develop a system like this. I can't find anything concrete regarding this rumor, so I'd take it with a grain of salt. What I did find was Microsoft Cloud for Healthcare, which is a cloud-based platform that has various healthcare related functions. I can't say for certain this is what she was talking about, but from what I read about it, it seems like it would be massively beneficial to the industry. So after the interview concluded, I thanked Miss Collin for her time, and we ended the phone call. I noticed that EHR systems have a lot of benefits, but there's also a couple of issues that were mentioned. For example, that a bunch of doctors quit because they didn't want to have to learn a new system. Uh, I'm not sure if it was because they didn't want to learn it or if they were afraid of the changes this could bring about. Uh, Perhaps if it was implemented at a slower rate, such a pushback wouldn't have happened. If I had a second chance at an interview, I wish I could have asked her about eClinical and how it was implemented, because that was the one that caused the doctors to quit. It was also the first one I'm assuming the hospital ever implemented, since it was the first one she's worked with, and she was there for when it was implemented. Um, Maybe there was a good reason for the problem or the apprehension regarding its implementation. Maybe not. Don't know. Unfortunately, I didn't ask her. Another issue that came up regularly throughout the interview was the overloading of information in the records. Uh, they would have too much put in. People would skip reading it altogether. Perhaps this could be solved by teaching how to properly put a note into an EHR, or perhaps they could have a limit on the amount of text they could enter in a note. Neither of those are great solutions, and I imagine if it was that easy to solve, it would have already been fixed. Um, in the end, though, this project had taught me quite a bit. Things that I saw thought were fairly simple on paper turned out to be a little more complex. I hadn't even realized how much of an issue this overloading of a document was. And while they may have a lot of problems, these systems are far better than what was being used prior to their implementation. If given a chance, I would love to talk to Miss Conlin again about this subject. Because after writing the project report and making this PowerPoint, I've got a couple more questions that I'd love to ask her about this subject if given the chance. And included are my works cited and acknowledgments. And thank you for watching.